Diabetes mellitus, commonly known as sugar disease, is one of the most pressing health challenges of our time. It is a chronic metabolic disorder characterized by elevated blood glucose levels, resulting from either insufficient insulin production, ineffective insulin action, or both. To understand this condition, we must begin at the molecular level, where insulin and glucose interact in a delicate balance that sustains life. Insulin is a peptide hormone secreted by the beta cells of the pancreas. After a meal, glucose molecules represented chemically as C6H12O6 enter the bloodstream. Rising glucose levels stimulate insulin release. Insulin binds to receptors on muscle and fat cells, triggering a cascade of intracellular signals that move GLUT4 transporters to the cell surface. These transporters allow glucose to enter cells, where it is either used for energy or stored as glycogen. In the liver, insulin promotes glycogenesis, the conversion of glucose into glycogen, and inhibits gluconeogenesis, the production of glucose from non-carbohydrate sources. Without insulin, or when insulin is resisted by the body's tissues, glucose accumulates in the blood, leading to hyperglycemia, the hallmark of diabetes. There are several distinct forms of diabetes, each with unique causes, onset patterns, and risks. Type 1 diabetes is an autoimmune condition in which the body's immune system destroys pancreatic beta cells, leaving the patient dependent on lifelong insulin therapy. It often appears suddenly in childhood or adolescence and carries the risk of diabetic ketoacidosis, a life-threatening complication. Type 2 diabetes, by contrast, develops gradually, usually in adulthood, though increasingly seen in younger populations. It arises from insulin resistance combined with progressive beta cell dysfunction. Patients may still produce insulin, but their bodies fail to use it effectively. This type is strongly associated with obesity, sedentary lifestyle, and genetic predisposition, and it carries a high risk of cardiovascular disease. LADA, or latent autoimmune diabetes in adults, is a slower form of autoimmune diabetes that appears after the age of 30. It is often misdiagnosed as type 2 because it begins with mild symptoms and responds initially to oral medications, but eventually requires insulin therapy as beta cell destruction progresses. Gestational diabetes occurs during pregnancy, typically between the 24th and 28th weeks, when placental hormones induce insulin resistance. While it often resolves after delivery, it increases the mother's risk of developing type 2 diabetes later in life and can affect the health of the newborn. The symptoms of diabetes range from subtle early signs to severe advanced manifestations. Early warning signs include polydipsia or excessive thirst, polyuria or frequent urination, polyphagia or increased hunger, unexplained weight loss, blurred vision, and fatigue. In type 2 diabetes, acanthosis nigricans, darkened patches of skin, may appear as a marker of insulin resistance. Advanced symptoms include diabetic ketoacidosis, characterized by nausea, vomiting, fruity breath odor, and deep labored breathing known as cusmal respiration. Another severe complication is hyperosmolar or hyperglycemic state, marked by extreme dehydration, confusion, and coma. Neuropathy develops over time, with peripheral neuropathy causing numbness, tingling, and burning sensations in the feet, while autonomic neuropathy leads to gastroparesis, erectile dysfunction, and bladder problems. Retinopathy damages the retina, causing vision loss and blindness, while nephropathy damages the kidneys, leading to proteinuria and eventually end-stage renal disease. One of the most important tools in diabetes management is the measurement of HbA1c glycated hemoglobin. HbA1c reflects the average blood glucose level over the past 2 to 3 months, since red blood cells live for about 90 days. The diagnostic thresholds are clear. Values below 5.7% are considered normal, between 5.7 and 6.4% indicate prediabetes, and 6.5% or higher confirm diabetes. HbA1c can be converted into estimated average glucose using a formula. Estimated average glucose in milligrams per deciliter equals 28.7 multiplied by HbA1c minus 46.7. For example, if HbA1c is 7%, the calculation is 28.7 times 7 minus 46.7, which equals 154.2 milligrams per deciliter. This formula allows clinicians and patients to understand HbA1c in terms of daily glucose levels, making it more relatable. The complications of diabetes are numerous and devastating. Diabetic nephropathy results from damage to the glomeruli in the kidneys, leading to protein leakage into urine. Over time, this progresses to chronic kidney disease and eventually end-stage renal failure requiring dialysis or transplantation. Diabetic retinopathy is the leading cause of blindness in adults, caused by microaneurysms, hemorrhages, and abnormal new blood vessel growth in the retina. Diabetic neuropathy affects both peripheral and autonomic nerves. Peripheral neuropathy causes pain, tingling, and numbness, especially in the feet, increasing the risk of ulcers and amputations. Autonomic neuropathy disrupts involuntary functions, leading to digestive problems, sexual dysfunction, and cardiovascular irregularities. Cardiovascular disease is accelerated in diabetes, with increased risk of heart attack and stroke. Poor circulation and nerve damage combine to cause foot ulcers, infections, and amputations, making foot care a critical aspect of diabetes management. Lifestyle management is the cornerstone of diabetes care. Diet plays a central role, with the glycemic index serving as a guide. The glycemic index ranks foods based on how quickly they raise blood sugar. Low GI foods such as lentils, oats, and apples release glucose slowly, preventing spikes. Medium GI foods like brown rice and sweet corn have moderate effects, while high GI foods such as white bread and sugary drinks cause rapid spikes. Patients are encouraged to follow the plate method. Half the plate filled with non-starchy vegetables, 1/4 with lean protein, and 1/4 with whole grains or starchy vegetables, with fruit and low-fat dairy added in moderation. Exercise is equally important, with recommendations of at least 150 minutes of moderate aerobic activity per week, supplemented by resistance training twice weekly. Physical activity improves insulin sensitivity, lowers blood sugar, enhances circulation, and reduces stress. Modern technology has revolutionized diabetes management. Continuous glucose monitors, or CGMs, provide real-time tracking of glucose levels through sensors placed under the skin. They reduce the need for finger prick tests, alert patients to highs and lows, and provide trend analysis for better decision-making. Insulin pumps deliver insulin continuously in basal doses and in bolus doses at mealtimes. They can be tubed or tubeless patch-style devices, and many integrate with CGMs to create automated insulin delivery systems. These technologies empower patients to live more freely while maintaining tight glucose control. In conclusion, diabetes mellitus is a complex condition that spans molecular biology, clinical symptoms, long-term complications, and lifestyle management. Understanding the role of insulin and glucose, differentiating between types of diabetes, recognizing early and advanced symptoms, monitoring HbA1c, and preventing complications are essential for effective management. With education, awareness, lifestyle changes, and modern technology, patients can live healthier lives and reduce the risks of long-term damage. Diabetes may be a silent killer, but with proactive care, it can be controlled and its devastating consequences can be prevented.